Hi, are you in your third or fourth year and still don't have a research topic or question? Well, no more worries, I've got you covered. Hi guys, welcome back to my YouTube channel. It's your girl Charlotte over here. If you're a returning viewer, thank you and keep coming back. If you are a first-time viewer, thank you for coming around. And please don't forget to subscribe, hit the notification button, like, comment, and share. So today I bring forward research topics suitable for nursing students and also medical students if interested. So stay tuned for the research topics and get a notebook, a pen, and write down and find something that interests you. I'm sure you're gonna find something that you might like. Well, like I said, I have combined about 6 research topics that are very suitable for nursing students, especially those in third year and fourth year of their bachelor's degree. So I noted them down in my notebook, so I'll be looking down just to read, and you grab a pen and a notebook and stay tuned, okay? Do not leave this, it is very important, okay? Well, like I said, I'm talking about research topics that are suitable for nursing students, medical students as well. So just get a pen, a notebook, write them down, and pick one that suits you, one that you might like. Most of them are actually obstetrics oriented, midwifery oriented, but I also put some together that are not really, yeah. Okay, so first one, attitude, knowledge, and practice of mothers on exclusive breastfeeding. Well, this is very important because some of the mothers are taught to breastfeed exclusively, but they don't really know why they are told to. They're just told to do it, but they don't have an understanding on why they should exclusively breastfeed their babies. So we need to research and find out if the mothers have knowledge, what is their attitude towards breastfeeding, and the practice, are they practicing it, or do we just tell them to do it and then they don't even practice it, like everything goes in vain. We need to research on this. We need to find out if they are practicing, if they know, if they have knowledge on why we are telling them to exclusively breastfeed. And also we need to find out if what is their attitude, what is their say on this thing. So it is very important actually, so consider that topic. Topic number 2, study to determine the knowledge of pregnant women concerning danger signs in pregnancy and its impact on maternal health. So we often tell mothers, we often tell mothers that come to ANC, we warn them about danger signs, minor and major signs, minor and major danger signs in pregnancy. But then it seems like, I don't know if we are not doing much in telling them, or there is communication or maybe language barrier, because you still find that a mother will be at home for 3 days and then she will come to the hospital on day 4 and tell you that her baby hasn't been moving. And when you ask her, "Mommy, how long hasn't the baby been moving?" she'll tell you, "No, today is the 4th day." But those are the danger signs we need to be talking about during at ANC. I don't know if we do it. So it is important to study to research on the knowledge of mothers, whether they know. And we also need to find out if they know how these danger signs can impact their health, which is now the maternal health. We need to know this, guys. We need to know because, yeah. Study number 3, a study to determine COVID-19 reoccurrence amongst patients discharged from isolation wards. Very, very important. As you all know, that COVID-19 hit us pretty hard in 2020 especially, and then in 2021 some people got it like maybe 3 times more. Some died, some got it once. So it's good to, it's always fine, it will be a good thing if we could research on this to find out patients that were discharged from isolation wards, how many of them came back with COVID-19 after they were declared healed, to have been healed from COVID-19. How many? Because we had cases where a person had COVID, survived COVID, and then maybe 6 months later they got post-COVID complications like pneumonia, and then they died. We need to find out this. We need to find the relationship between the first COVID-19 infection and the reinfection for these individuals that has been discharged from isolation wards. It will be very, very important, so you should consider doing it. Study number 4, a study to assess mental health impact of COVID-19 pandemic on health workers. Very, very important. Yeah. As a health worker alone, I was traumatized. I was traumatized by the pandemic, guys. People died. People lost their loved ones. It was like the death was just so chaotic. You just didn't know what to think. It was really rough. So it impacted most of us mentally, because we also lost some of our colleagues. We also lost our family members while taking care of other people. It was just hard. So I think it's just fair enough that some of you do research on the impact it really had on us, on the healthcare workers. It's just fair enough. So don't miss out on this great topic. It's beautiful. So plus your, what is this, your sample, your population to be the healthcare workers. You don't have to go into the community and look for people to partake in your study. You might as well just do it on the nurses and doctors at the hospitals. So yeah, that's really rough. Research topic number 5, incidence of bacterial vaginosis, also known as Candida, amongst pregnant mothers attending ANC. So bacterial vaginosis is very common in pregnant women. Sometimes they can get it from first trimester till delivery. Even when treated, it just reoccurs, like it doesn't go, it's always there. And then you find women that get it maybe from their second trimester, or some that don't get it at all. So why not just, research on the incidences? Go to the ANC, wherever the ANC, and find out how many of you guys, how many, check in the records of the ENT clinic, and then you can find the incidences there. It's also a very nice research topic, so consider doing it. It's nice. Don't. Research topic number 6. Study to determine relationship between substandard medication and increased drug resistance amongst patients on antibiotics. So this topic is nice, and a study setting can be pretty much anywhere, any clinical setting where there are patients that are on antibiotics or on any kind of medication. So important why we want to do this research is it will help us understand why a patient should not take why a patient should not take antibiotics for a longer duration, and why they shouldn't take it for a shorter duration than it is prescribed by the doctor. And it will also help us understand why it is important that the patient gets antibiotics not more than, I meant to say why the doctor should not prescribe many antibiotics at the same time that target the same microbe, because then it causes your body to be resistant, because all these 3 antibiotics that are targeting one microbe might end up not doing its course, because they're all doing the same thing, and one gets there first, the other one comes, and the other one comes, so not doing any help to the patient, but we are just actually weakening their system. So yeah, consider taking this topic. It is a good one. Thank you for tuning in into my channel. I'll see you next time. Don't forget to subscribe, hit the notification button, comment, like, and share. Watch out for our next coming video, and have yourself a good day. Bye. Much love.